not helping Tony, or you're not helping Adeyeye or anybody. Because before you know it, it starts from that time. The parent is the one that can take care of the life of that child, especially if there's a history of diabetes in that family that you know of. It doesn't have to directly be you. My brother has it, my children have to be careful. My uncle had it, I have to be careful myself. So all these things, all that I said about diabetes, life modification, the way we eat, our exercises, everything goes for diabetes. And we have to come down on our weight. Sincerely speaking, our weight needs to come out. Some people, there are some exceptions to the rule, really. You try so much and the weight is not coming down. But with such people, they need to go to the gym. They need an instructor with them to help her, because it can really be tiring, it can really be bothersome. When I've done everything they are saying I should do and it's not working, then you have to enroll in the gym. You need an instructor to help you out. But your weight needs to come down. We have to eat rightly and live rightly and have a good life. Thank you very much.
Thank you. Thank you very much, Adeyeye. Do you have any questions? One or two? I'm sure she's answered most questions within the course of the talk. But let's take questions.
Okay. About the diabetes. Yes. About the diabetes. When you have diabetes, you have to go down on your weight, as you said. But the after effects of the drugs matters a lot.
Okay, when we talk about after effects of the drug,
yes.
Okay, that's why you still need to go to the hospital. When you're diabetic, there are a whole lot of things that are left out in diabetes. First of all, we start the diabetic diet. When we talk about diabetic diet, it doesn't mean, eat black plantain, eat red plantain. No. All you have to do, if you were eating 2 wraps of iyon before, I'm not saying you should not eat iyon again. I'm saying just eat 1 wrap or half of a wrap. So everything about your lifestyle changes. Food changes, intake changes, everything changes. Exercise changes. And you have to be seeing the doctor. You even have to see a dietitian. You understand? And when you talk about the effects of the drugs, that's why the hospital follow-up. I skip that part. Follow-up is very, very essential. Because I give you a diabetic diet, I give you a drug, and you go into hypoglycemia. Hyperglycemia is fine. Hypoglycemia can kill you faster. Hyperglycemia is diabetes. You have high blood sugar. The blood sugar has dropped below the normal level. And that can make somebody die. You start sweating fast. You start sweating, you become delirious before you know to go into a coma. If people don't come immediately and help you, then the person is gone. And guess what? Ordinary sugar in your mouth, that time you started sweating, reverses the situation. There's some drugs that will make you go into hypoglycemia. That's why they will not give you. we talked about race. So our race and our gender and the things we do, the activities we involve ourselves, also affect that drug we are using. So that's why when the doctor gives him, he gives him a short visit. The first time you are noted to be diabetic, they tell you, oh, come back and see me in 1 week, especially if you have been admitted. You came in with coma or you came in with hypoglycemic crisis. They say, come and see me in 1 week. If you came into the clinic, you walked with your own 2 legs and come to the clinic, I give you a 2 weeks appointment. And I keep seeing you 2 weeks. Why am I asking you to see me in 2 weeks? Not because I want to see your face, but because I want you to come and tell me, doctor, when I go home, I started feeling funny. I feel numb on this hand when I started using drugs. And women are good. We are very, very good. We can quickly calm down on something and say, but and most times they are right. It's only when you come to the doctor for follow-up that like, they'll tell you, madam, I'll have to change this drug or I'll have to remove this drug. So that's why a follow-up is needful and useful. Because when you come, they can calm down, they can easily look like, how she's reacting. And most times when you come, it starts as a case study. Some people have never come to the doctor to say that they complain about the effect of a drug. And truly that drug has an effect. People do the study and they find out that, she's correct. The number of people who gave these drugs, they came back after 2 weeks to say this is what is wrong. They will now tell you, if you are hypertensive, diabetic, sorry, you cannot use this drug. Is this particular one you can use? Do you understand?
Yes.
Okay.
Let me ask you a question.
Okay.
There's 2 types of diabetes.
Okay. Type 1, type 2.
Type 1, type 2.
Okay.
There's some other one goes on insulin.